Welcome back to CBS This Morning. Michigan's Republican-led legislature has voted to sue the state's Democratic governor to stop her extending the coronavirus state of emergency there. Hundreds of protesters, some of them with guns, gathered at the state capitol yesterday demanding an end to emergency restrictions.
Only 6 states have reported more cases than Michigan, but fewer than 2% of its people have been tested for the virus. In our series on the state of coronavirus testing, Adriana Diaz shows how Michigan is trying to improve a system that has failed some of its people.
It's just like having your heart ripped from your body.
Kayla Carruthers' mother, Deborah Gatewood, worked at Beaumont Hospital outside Detroit, drawing blood for 31 years. But when she came down with a fever last month, her daughter says that same hospital denied her a COVID test more than once.
How many times did she try to get tested?
4 times.
And every time, what happened?
She got sent home each time. She lost faith in the whole healthcare system.
So your mom, a healthcare worker, lost faith in the healthcare system.
Isn't that crazy?
Beaumont Health told CBS News, "We're doing everything we can to evaluate, triage, and care for patients based on the information we know at the time. We grieve the loss of any patient."
Helping Michigan families.
Michigan Governor Gretchen Whitmer has since expanded testing criteria to include milder symptoms and all essential workers.
We spoke to one of your constituents who lost her mother to COVID-19 after being turned away from a testing center 4 times. Did you expand that criteria too late?
I think that's the saddest reality of a country that was underprepared for a global pandemic. The fact that we've never had enough tests, that the federal government didn't prepare, contributes to the fact that we had to ration tests at the front end of this pandemic. And I recognize that lives were lost.
Testing has doubled in recent weeks, but shortages of swabs and chemical solution are still an issue.
The CDC guidelines are that we should be testing between 1% to 2% of our population over the course of a week in order to have some confidence that it's safe to reopen. And it's going to be a little while before we get there.
The governor's goal is to test at least 14,000 people a day. Right now, they're doing roughly half that. The epicenter is the Detroit area, which accounts for more than 70% of the state's cases, and disproportionately, people of color.
Ready? All right.
There, walk-up testing has been set up to reach residents without cars. By executive order, the governor has shut down most of the economy, drawing ire from a small but vocal minority. Some think she's gone too far, like Sheriff Ted Schendel of rural Benzie County.
Keep in mind, we're on executive order number 60.
I detect you feel a certain way about that.
Well, yeah, because it's just one right after the other. It's a one-size-fits-all kind of approach. Well, I can use my county example. We have 0 deaths. Let's give us a chance to get out, go back to work, put food on the table for our families.
But the governor says testing above all else will help determine when to fully reopen.
Some people will think we should move faster. I'm going to listen to the public health experts, and I'm going to work with the business side of the equation to make sure that we've got the protocols to keep people safe when it is safe to start to re-engage.
The governor says she may further open the economy region by region if the data shows it's safe. Now, putting Michigan back to work won't make up for the roughly $3 billion the state estimates it'll lose because of the pandemic.